Hi, everybody. Welcome to our Health Careers Cast. This is a series of podcasts where you can hear and learn more about different healthcare professions from professionals and students themselves. Our first speaker is Mike McLeod, who is a physiotherapist. Mike talks about his experiences, about what he loves about being a physiotherapist, and more. Keep listening to hear more about what it's like to go into physiotherapy.
Okay. All right. Awesome. Hi, Mike. Welcome. Thanks for joining us and being part of our virtual healthcare event. We're very excited to be interviewing today and having you with us. So thank you. Before we start, would you like to give a brief introduction of yourself?
My name's Mike McLeod. I am a physiotherapist. I've been a physio since 2014. Previous to that, I did my undergrad at UW in kinesiology in the Co-op program. And then I did my master's of physiotherapy at McMaster and then been working since then. And I'm not from KW, but I fell in love with the region during my undergrad, and my wife and I worked our way back here, and we've been here ever since.
Awesome. What was your experience like in kinesiology, and were you in the co-op program?
Yeah, so I was part of the co-op program. So I guess the honors bachelor co-op. It's a fantastic program in terms of kin programs. It's probably the highest academic kin program that I am aware of, especially in Ontario. Especially moving to the next level of academics, going to the master's level, you start seeing it was a collection of everybody from all these different walks of life, every different school programs, different kin programs. There were moms, there was dance majors, there was history majors, and it was really interesting. Obviously, the majority of them being kin majors, but it's really interesting getting everyone's else's kin experience and seeing how that there is quite a bit of variability between the programs, and really I found it highlighted how strong the UW kin program was. And how I was actually quite prepared for at least the first year of the master's program.
Yeah, I hear it's quite competitive too.
Mm-hmm. Mm-hmm. Yeah, I just got lucky. I snuck through the cracks, I think.
And so as a physiotherapist, can you describe what you typically do at work?
So I work in private practice. So I work at clinics. So my clinics are in KW. I work at one in Baden and I work at one in Kitchener. And my job basically entails the assessment, diagnosis, and treatment of orthopedic conditions. So muscle, bone, joint conditions, sports injuries, work injuries, car accident injuries, things like that. I've seen little infants and I've seen elderly people. So it's a wide range. The cool thing best thing about this job, or one of the best things about this job, is that you don't know what's going to walk in the door any given day. Mm-hmm. So when you meet people, it's just about meeting people and talking to people and communicating, and you're a body detective. It sounds kind of lame, but you're really trying to figure out kind of what's going on and their story and how it relates to their injury, and how to take not only that injury or that particular issue, but also that person and kind of treat and rehab that person, not just their elbow injury or something like that, right? You got to make it applicable and important to them. Otherwise they're going to kind of fall off and not take your advice and your knowledge and things like that.
Yeah, consider that human aspect as well. That's great. And before you went into the orthopedic specialization, did you try out anything else? How did you know that this was the right one for you?
One of the advantages of the kin program at UW and the McMaster physio program, or all physio programs, is you have to do placements and co-ops and work in these different environments. And that was one of the biggest reasons I decided to go to UW for kin, was the co-op. It was the best opportunity. Yeah, I extended your undergrad by about 8 months, I think it was. But it also worked for 2 years total combined during that time, and paid positions that I was able to, obviously financially that helped out during school. But also I made it a priority for myself to really make sure I worked at different settings. So I in undergrad, I'm trying to remember them all now. I worked at a clinic. I was just like a kind of a kin assistant at a clinic. So I was folding towels, helping with exercises, working with different modalities on patients and things like that. And then I did research with a few different professors. I worked with the UW welfare program and was, implemented and designed programs for that. Trying to think, I worked with an occupational therapist company, and then that really set up allowed me during my 5-year undergrad to kind of narrow down like what field I want to go into. Did I want to go into research? Did I want to go into, I debated medicine for a while, and I debated other things, chiropractic, college, and ultimately I kind of wound up leaning towards physiotherapy. There's a few courses I took later on in my undergrad that kind of helped guide me towards that, and it was a job I was really interested in doing. And then during my master's, again, same thing. They're a little bit more strict in their placements, so you have to meet certain criteria. You have to do a hospital placement. You have to do a private practice placement. You have to do a rehabilitation placement. So those are in different settings to get you exposed to different types of physiotherapy career paths. And although I enjoyed the medicine side of things at the hospitals and at the rehabilitation, those jobs are ultimately harder to come by. There's just not as many hospital physios out there. And I enjoy the fast pace of the clinic life. I enjoy seeing lots of different people talking about their stories and who they are. And I really enjoy figuring out what's going on rather than just kind of getting them. The goal of hospital therapy is ultimately discharge. That's also the goal of community therapy and private practice therapy, but I have a bit more freedom. I'm my own boss. I can really dictate. No one's telling me how to do my physio or what I need to do. It's all on me, and I really enjoy that freedom to be creative with it and really help people in that way.
Awesome. Yeah. As a co-op student myself, I think I agree with different trying different out positions really helps with what you want to do in the future.
Yeah,
so, yeah.
That's the hardest thing about finding a career path, is trying to determine what path you want to go down. And instead of making, not necessarily a mistake, but making a choice and not enjoying it as much or not having as much information, it's always better. And undergrads will understand this, that the more research you do, the more knowledge you have, the more understanding you have in a certain field, the better prepared you are to do that job. And so having the freedom during your undergrad, when you're unsure of what you want to do, you're unsure of the path you want to take, it gives you more ideas of things that, oh, I really didn't enjoy that. I don't really want to pursue that. Or, hey, that's something I might be just interested in. Let's go down that path a bit and see how it works out.
Yeah, awesome. Yeah. And it's not just co-op as well, with volunteer work or just different positions as well. I think that applies.
Really absolutely. Well. And in the upper year, I really found, like, as I got into the upper years of my undergrad, that's where I really started to enjoy. I'm a nerd, so I enjoy school, but I really started to enjoy it more in the upper years because I had more freedom to pick classes and pick courses. And it was funny because I did end up taking, obviously, outside of kin courses, but I took a lot of kin courses. That's what I was interested in. That's where my interests lie. And that's where I wanted to pursue more knowledge and try and gain more understanding in that field. And it definitely helped me prepare me for more schooling and career path that I've taken as of now.
Yeah, that's awesome. And you mentioned a bit about this, but like, what are some things that excites you the most, and what's your favorite part of your job?
I would say two things kind of stick out in my mind. I would say the number one thing would be really trying to figure out what's going on. You're someone's coming to you and telling you, I have a sore knee. Okay, well, what makes it sore? How is it sore? When does it feel better? And trying to, like, you're basically, you're an interviewer, you're a conversationalist, number one. And most of the job is talking to people, trying to figure out, because you can't feel what they feel. You can't understand how they feel. You're just trying to figure out what they're telling you. And you're testing your objective stuff. The stuff you do physically does help confirm that. But by the time you get to that point, you should already have narrowed down a few things that you think is going on. I think that's probably the number one thing, is just really trying to figure out and perform a good interview, a good assessment, and really nail down what you think is going on and how to apply it. And probably the second thing is, I just like talking to people. I like talking about people's stories. I like talking about what's going on in the world. I enjoy that. I think that's very important for everyone, to talk about these things in a safe place and be able to express your opinions and not be necessarily held down by certain structures and things like that, and just having that ability to just talk to people.
Yeah. And would you say that everyone is kind of different? There's no like similar situations? No.
Nothing similar. And that's really probably the biggest thing you learn from taking from an academic course into an applicable course, or a course where you're doing more hands-on work. Like some of the undergrad courses I took they were lab-based. Rob Burns had a sports injury course. It was all in the lab, all in the clinic, and we were working on each other doing physical things. And that's where you start really learning that what you read about in the book doesn't necessarily translate to what is in front of you in talking to that person. So, you're not just treating that elbow injury that's relatively simple. You're treating the person that has that elbow injury and what their goals are and what they're worried about, and how to kind of manage those waters and things like that. And that's kind of where we had to write a paper early on in my physio masters, where we had to debate, is physiotherapy more of an art or more of a science? And it was really hard to actually debate that when you start really thinking about it, because the art of it is having that conversation, having that and applying it to that particular person. And that's the creative side of it. That's really fun.
Do you find that there's anything like, what's the biggest challenge that you face usually, and how do you go about it?
There's lots of challenges, right? It's a job. There's still paperwork. There's still things that you don't enjoy as much that you got to do. And that's just all part of it. I think the biggest challenge is trying to stay up to date with the research and the literature. In your schooling, you do have more free time. You think you're busy, but you're not as busy as you are. So you get a little older and get a family and a house and a kid and things, I remember thinking like, I'll set aside a couple hours every week and read research and read the papers and stay up to date. And I still do my best, and it just gets harder. And that's probably the number one thing I would say. Hopefully with emerging technologies, it gets easier to disseminate that science information out. And I think that's true for all fields, not just physiotherapy. Mm-hmm. It's trying to get that information out there in a digestible way, so then that people in the clinics, in the hospitals, on the front line, so to speak, and implementing these things have that information and can get the most up-to-date information. That's really how to make healthcare as best as possible.
How much time do you usually spend on research, typically?
I usually try to spend a couple hours a week. Just try to pick maybe two papers, three papers, and just read them and try to come up with some notes about it. And usually I try to make it applicable to something that I'm dealing with at that time, something that's not quite getting better. And we have a group of clinics that are all kind of connected, and we do monthly like lunch and learns. I don't know, we had a big break with COVID, but we just had a recent one, and we talked about we're talking about low back pain and osteoporosis and how kind of that affects things. And just kind of someone does a little presentation, quick little 20-30 minute presentation, discuss it, talk about some patients or challenges we have with that particular kind of case, and get different ideas and bounce ideas off each other, right? Mm-hmm. When you start working, you get in the groove and you start seeing your own people, and you don't kind of talk to other practitioners as much because you're busy and life happens. And so that collaboration, that work together, that kind of sharing knowledge, hey, try this, try that, have you thought about this? It's really important, and it's good to keep you on your toes, and it gets you kind of less in the ruts. It's very easy to get stuck in ruts when you're working and plugging away.
Yeah, it sounds like you need to be up to date quite a lot, like just be on your feet.
Yeah, and there's always, and that's the great thing about physiotherapy is there's a lot of really strong research and literature out there, a lot of good researchers doing work, and it's an ever evolving field. And if people are wondering about how can it change, well, just look at a big example is pain science and how much we're adjusting even how we speak to patients about, certain words can make them more pain focused or pain centered or more agitated or things like that instead of, calling it, well, you have a tear, you have something's broken or something like that. Even just adjusting the words like, nah, it's probably not, it's probably just irritated, it's probably just angry, it's probably just, we need to settle it down and strengthen it up, not a big deal. And just speaking like that, first of all, you're not going to lie to the person. If there's something serious going on, you need to communicate that.
Yeah.
But, for the most part, people are dealing with just little injuries, nothing too major, and just kind of giving your knowledge. You live in this world, that stuff off the back of your hand. They don't, right? They're plumbers, they're teachers, they're electricians, they're all sorts of people, and they know their field very well, and you're just trying to make them comfortable in your field.
Mm-hmm. And were there any learning moments where maybe some people who find pain? Was like pain. This is going to be okay, but it's actually pretty serious. Has there been any of those kind of moments where you learn from those?
I mean, there's lots of moments where lots of people, I can't even think of how many people I've seen and treated over the 6 years I've been a physio, but there's lots of moments, good and bad, where I've looked back and like, wow, that I didn't handle that one very well, and that's just part of growth as a person. The more people you see, the more people you treat, you become a better therapist, you become a better person, and it takes time. It takes time to get that knowledge and understand that knowledge and be able to apply that knowledge in a succinct, effective way. And there's lots of people that I'm sure I would do a way better job rehabbing now, but and on both sides of things, there's some things that are relatively simple that sometimes go off the rails, and a lot of it is just how you communicate with people and the type of person you are and how you kind of work with that personality. That's probably probably one of the more fun but challenging parts of the job.
Yeah, I think it's important for students to know that too. Just even when you start working, there's still a lot to learn, mistakes to be made.
Correct. And that knowledge piece is like, you can go to undergrad, get all your courses. Yeah. You know your chemistry off the back of your hand. That's fantastic. That's great. But it's the soft skills. It's learning how to communicate, it's learning how to have a professional conversation and how to really investigate things further and things like that. That's where working in groups, and a big part of the physio program and the kin program, actually both, was, especially as you got in the upper years, were smaller classrooms, working in your little groups and having to work together as a team and bounce ideas off each other and work towards a common goal is super important. And that's how everyone gets better, not just you, everyone gets better.
I'm curious too, how has the pandemic affected your work environment and then your delivery of treatment?
It's affected it quite a bit. So we were off for 10, 12 weeks before the government allowed us. I believe we were amended into the stage 1 reopening. Kind of after that had opened, we were a couple weeks after that, they okayed us to open. In terms of what day to day, it's mask full time. It's goggles as necessary, depending on the patient. It's screening questions before, during, after. It's cleaning everything, disinfecting things. So it's added more protocols in place. But in terms of how the actual delivery of the physiotherapy, it's the same. It just looks a little different. It's the same. There's not much change. We're doing some things over Zoom for people who maybe aren't feeling as well or aren't as comfortable coming into the clinic. We're trying to triage people who need to be in, don't need to be in, can come in less frequently, things like that. But for the most part, when we're seeing people, it's the same thing. It just looks a little different.
Mm-hmm. And that communication skill is really important with
absolutely,
Zoom as well.
Absolutely. Yeah. Awesome. And just kind of managing all that. And that's just part of the job now.
Part of the learning process. Yeah.
Part of the learning process, right?
Yeah. And so what made you decide to become a physiotherapist? Was this a career interest that you've been wanting to go into since you were young, or was it something that you kind of decided when you were in undergrad?
I think it's something I was always interested in. I like the idea of trying to get people better. Healthcare was always something I was kind of interested in. I was really interested in anatomy and physiology and biology. And those were kind of my fields, and even in high school and in undergrad. And I think I'm not a desk person. So, working in a research lab I wasn't as good at that as other people were. And I think I like the fast pace of it. And I think it was something that I was kind of always knew I was going to go into or go towards. And then a few of my different co-op experiences and speaking with other clinicians at those co-op placements really helped kind of push me towards that. And I knew after my undergrad, I wasn't I guess satisfied, with my level of education. I knew I could kind of push for more. And I honestly didn't think I would get in. It is pretty competitive, and I was pretty happy when I got in, and the next step was passing all that and getting through all those exams, and then passing the final exams and the board exams. And so there's a lot of steps involved, but it was something I was always interested in. And having dealt with a couple injuries myself throughout the years, and seeing friends and family go through that as well, it was something I was like, oh, might be a good career path. You're still using your hands, you're still not behind a desk all the time, but you're still using your science, your knowledge, and your all the things that you've learned over the schooling careers, and that to really help implement that.
Yeah, and experience is invaluable too, just to figure that out. Yeah,
mm-hmm.
Amazing. And So what was your process like applying to your master's and master? Because you mentioned it was competitive.
Mhm.
And how did you go about it? Any experiences, getting references and all that? What was your application process like?
So, it's stretching my memory a bit, but I applied to all of the physio schools in Ontario. I think there's Toronto, Western, McMaster. I think I'm forgetting one. Queens.
Mhm.
And there's 4. I think there's one in Ottawa. I believe it's French speaking, if I remember correctly. So I think I applied to all 4 of the English speaking physiotherapy programs in Ontario. I didn't want to go to a province. That wasn't really an interest for me. And it was very dependent on the program. So certain programs had different criteria.
Yeah.
GPA is one of the main criteria. That's true for, you got to get above that line in order to be looked at.
Yeah.
Western was purely GPA. They didn't really look at anything, any extracurriculars, any interviews, anything like that. Queens was a written interview. So, they gave you 5-6 questions, I think, you typed up your answers and submitted that along with your transcript and GPA and things like that. U of T in Toronto was a computer-based interview process. So you actually go on site, complete a 2 to 3 hour, I believe it was, like computer interview, same thing, just typing up answers to, ethical, moral questions, just trying to see where you are in your kind of decision-making, clinical reasoning. It wasn't necessarily about knowledge in physiotherapy, but it was, very generic. Where do you sit on the fence with these things? Can you think of problems from different angles, different directions, and appreciate other people's views, even though you might not agree with them, but appreciate where they're coming from and be able to use that? And then McMaster was the MMI, multi-mini interviews, where, little rooms, and each room has a specific question on it. You go, buzzer goes, you go in, answer the question. And actually, it was as nerve-wracking as it was actually a decently enjoyable process, because all the questions they're not asking you, where does this muscle go or what's it do? It was just asking you, how do you feel about these things? Where do you sit on these particular question or topics? And a lot of it was ethics and morals, and just trying to see what kind of person you are and how well you communicate. Again, communication, big thing, especially in healthcare. I think that's one of the biggest problems in healthcare is we're not doing a good job communicating with patients and explaining to them what we're going to do, how we're going to do it. If it doesn't go right, this is what we're going to do. If it goes well, this is what we're going to do. Kind of go through the tree of potential options and potential things that could happen. So then after all that process, you kind of wait. And then I heard back from a couple schools and I picked McMaster. I believe I got into Toronto and McMaster, and I decided to go with McMaster. I actually thought the interview process was going to bring out the best in the candidates and best in the field. And it's a very good program, very solid program. And then just start the process of that.
Yeah, amazing. And you said that you were in Waterloo. What did you use any resources that you reached out to help you prepare with like interviews when you were in undergrad, specifically like on campus or off campus?
So I did a few volunteer things where I was speaking with different clinicians. I kind of did some volunteering at different clinics in town, just to kind of pick their brains about things. It's another thing to kind of pad your resume and put on there. And it is important to show that you are interested in the field. You should kind of be interested in it before you pursue a career in it. There are some people who, let's say, don't get into medicine and use physio as a backup. And I, those are good physios. They're still great people, but I always want people that are in and interested in the field to be in the field. Those are the people that are going to be the most passionate, care the most, and try the hardest. So just speaking with different professors, different, especially in the upper years, you start getting to know them a bit better because you're in the smaller classrooms. Make sure you ask questions. I worked with a few professors on different co-ops and through some summer programs. In terms of helping them with their research, and I just kind of developed a couple of relationships with them, and then they helped me with, they provided me with references and things like that. You can't be afraid to just ask them questions and speak to them further about what's going on. And it's ultimately, it is about, you need to pass your exams. You need to get a certain mark to stay in the program and apply to the next level that you want to get at. But it's your learning, it's your knowledge. It's if you're passionate about it, pursue it. See what you think. You might really enjoy it.
Yeah.
And I think that really helped again, having that open communication, you don't just go to a prof and say, hey, can you write your reference letter? Because they're not going to know you. But you need to kind of develop that relationship first and kind of so they know who you are, so they know what to talk about, right? Otherwise, they're just going to say, yeah, you're a great student. Okay, that's super helpful, right? You want them to show you and write about you and really get across who you are as a person, not just as a student.
Yeah, taking advantage of those office hours and really being engaged in the content. Yeah. So before you went to this specialty, and for individuals who are just starting to think about it or deep in the planning process, what's something that you think is helpful for them to consider before going into this profession?
I think it's helpful to. It's a good question. What would be helpful in this profession? I guess making sure, like I said, you need to obviously have a certain level of knowledge to be able to complete the job. You need to know some things before you're able to implement those things. And I think that's a good place to start, is making sure you are interested in the field. Go talk with a physio. Something I offer is if I am treating a patient and they say, oh, my grandkid or my son or daughter is interested in pursuing kinesiology or physiotherapy, I say, hey, if you want, this was all before COVID, but if you want, bring them into your session and I can talk with them while I'm working with you. And especially if you're okay with it, and I'm okay with it. Sure. It's just, you just got to ask. And a lot of times you're going to get a no, but sometimes you'll get a yes. And just trying to make sure I would say, talk to people in the field and figure out if that's something you're interested in. Go volunteer somewhere, go ask if you can shadow for an hour or two and things like that. And that's where you start really learning about the career and about what it's all about. It's hard to see it from the outside until you really kind of get into the nitty gritty of what's going on. And that's where it really becomes pretty interesting.
Yeah, I think that's something that I've learned too, just reaching out. And if they say no, they say no.
Exactly. It's no skin off your back, and you get a lot of no's, but when you do get a yes, it's usually a good experience. And people, I got to say, physios are really good about kind of sharing their knowledge and inviting people into the group. It's not this little clique. It's we're pretty open people. As a group. And I think that's super important. I think that's important for, first of all, promoting the profession, but also just promoting being a good person and a good person in your community and helping other people out. No one gets there on their own. No one gets through undergrad without any help. No one gets through masters or anything like that without help. And hopefully people can understand that. And when they get to the level where they can help people, they do,
That's amazing.
And that's pay it forward a bit, I guess.
Yeah, it's hard work. So yeah, that's amazing to hear. And so if you could go back and do it all again, is there anything that you would do differently or anything that you would do the same? I hear that you've gotten a lot of experiences, which is amazing. Anything that you would change?
Would I change anything? I would say for the most part, no. Like, it led me to where I am now. Obviously, everyone makes mistakes. There's a few midterms I'm sure I could study a little harder for and things like that, a few in particular. But no, I mean, for the most part, my goal was to always balance my extracurriculars and my school and my, I guess, outside of school lifestyle. And try to really find the balance. And that's something they really talk about in physiotherapy. It's a program where you can spend every waking minute reading physiotherapy research and trying to learn more. And because a lot of it at McMaster especially is self-directed. So the more effort you put in, the better your knowledge is. And so they try to teach you really early on to find that balance and find that you got to figure it out. And it's not all, sometimes it's worse than others. Sometimes you're out of whack and you're, working too hard, but it's trying to find that balance. I always made time to go to the gym or try to exercise or try to, just sit with friends and just talk and things like that. And I think that was really important. Obviously harder at times, but I was always trying to, each semester I was trying to do something. So I played rugby for UW. So in the fall semesters I was playing rugby. When I was on co-op, I was trying to, maybe do some more personal reading or working out more, or, in the summers I was volunteering or things like that. You just kind of try and make yourself a good person, not just a strong student. I think it's that's kind of the goal of undergrad, is really trying to grow as a person. And obviously you need to gain your knowledge, you need to pass your courses, you need to, get your undergrad and reach that level of understanding. But, I started school when I was 17, I think, when I was in my undergrad. So I was pretty young, moving away from home, new city, knew everything. And I was still a kid. And I think trying to figure out what kind of person you want to be is super important. And I think, I hope undergrads don't lose that. And I think COVID hurts that a bit, but hopefully we can, hopefully it's gone soon. And the other thing is hopefully we can still instill or continue to instill like the community aspect of UW, and it was amazing. I had such a great time at UW, and I think really working together is important.
And that balance is something that a lot of people may struggle with too. And you mentioned with COVID now, it's hard to get those experiences, but hopefully there are like online volunteering, but it is different. Yeah,
it's definitely different. It's definitely hard, and this is going to be, this is a year for the history books, so we gotta keep that in mind. And it's not the same as it was last year, and it won't be the same next year. And we just gotta kind of put that in our back pocket, and hopefully we can continue to move forward. And I think I'm a big balance person. I talk about that a lot with my patients, and just trying to find that balance of like you want to work it, but you don't want to work it too much, and you want to and that balance is different for everyone. And I think it's super important to make sure you take care of yourself, make sure you take care of your friends, make sure you take care of your family, and still accomplish what you need to at the end of the day. You still need to, like I said, you still need to study for the tests, you still need to pass the midterms, but you're trying to figure out and make sure that you're not overdoing it, right? It's okay if you get a 65. It's okay. You'll be okay. So just trying to find that balance, and that's true for everything in life: job, career, life, family.
Yeah, I agree. Were there times where you felt demotivated when you were working through this, especially when you were in undergrad or when you were in your master's?
Absolutely. I remember I didn't take physics in high school. I did chemistry and biology, and I kind of avoided physics. Mm-hmm. And the teacher was scary, so I didn't want to have it. And first year of physics, I was playing rugby, and I got crushed by the first midterm. Like, I think it was the first exam I had failed, and that was a real big realization. First semester, whoa, this can happen. Right. Mm-hmm. So I met with the professor. I got some, friends on the rugby team to help me out and help me study. And I passed. And there's definitely times, and that happens all the time. Still happens. COVID has really made me question whether I want to keep going in physiotherapy and how challenging it is. And I think it's good to have that inner dialogue of making sure you're still trying to pursue something that you are passionate about or at least interested in. Mm-hmm. And I think there's always going to be times when you doubt yourself and when you question what you're doing and when you're, oh, this is not good, or demoralized or unmotivated. And I think always realizing that trying to find a long-term goal, a medium-term goal, and a short-term goal. And I think that really helps. Organize your space, keep your life organized, and that will help. And just trying to manage that and recognizing that and being okay with it, Mm-hmm. COVID, for example, it's normal to feel anxious and depressed and things like that. These are very intense times that we're living through and trying to manage and work through. And it's not easy. And I like to consider myself a mentally strong person, but there were days when it was not that easy. And I think it's okay to say I struggled, or it's okay to say it was hard or it was challenging. And that's not diminishing anyone else's struggles or challenges, but just speaking from yourself. And that's all you can do, right? And I think just being able to recognize that and be able to tell yourself like, oh, that was a tough day. That was a tough one. And finding ways and things that bring you joy and bring you happiness, whether it's going for a walk, listening to some music or a podcast, reading a book, whatever it is, just trying to find that and use that as your outlet to kind of help reset yourself. And again, it's all about that balance, I think, and trying to find that balance of, how hard do you push and how hard do you relax, and all that kind of stuff.
Yeah. It's important to find what works for you. Yeah. And so this last question, actually, how do you take care of your health and well-being? And this can be answered about your current situation or when you were undergrad. How do you, mm-hmm. And you mentioned about balance. Mm-hmm. Yeah. So how do you take care of your health?
So during school, it was, making sure I always read. I'm a big reader. I said I'm a nerd. I read weird books, but so I spend time before I go to sleep. I read something about not school, not papers, not textbooks, nothing about that. I tried to just live in a different world and a little bit of an escape. I was always trying to be physically active and healthy in that sense. I think that's a big part of it. All the research does show that the more physically active you are, the better it is for sleep, the better it is for energy levels, the better it is for stress reduction and things like that. So, people always ask me, well, what's the magic pill? What's the easiest thing I can do to make me better? It's exercise. And it doesn't even matter what type of exercise. You can do Zumba, you can do run up hills. I don't really care. Just do something. And it does work. It does make you feel better. It does make your body healthier. The better you treat your body, the better your mind is. The other thing would be try to keep my spaces as organized as possible. The more organized you are in your space and in your life and in your calendar, the easier it is for you to kind of you don't miss as many things. You keep on track of things. Things don't get lost in the shuffle. Little things like even making sure your email inbox is up to date and not cluttered with stuff that you don't need to deal with. And even that's important. More personally, I have a young daughter and a wife, and trying to just spend time with her. And my daughter is amazing at kind of resetting me. And even if it's a tough day, you go home and she says something, and you smile and laugh and move on. But again, connecting with family and friends, and even if it's just a little text message to be like, hey, my buddy sent me one today. I hadn't talked to him in a while, and he said, I remember this song from undergrad. We were talking about it the other day, and just little things like that. And I try to also spend a lot of time outdoors as much as possible. I think something, especially COVID, has kind of accelerated this. We're spending more time indoors. We're spending more time, apart from people, and and people can get us sick. So maybe we don't need to spend it with other people, but trying to spend time outdoors and trying to reconnect with nature. And nature's the coolest place to learn. Nature and biology and all that stuff is extremely fascinating. So trying to kind of find that thing that interests you and makes you click and pursuing that. And it seems to really help reset you in terms of reducing stress and managing issues and problems and things like that. And probably the last thing is trying to really figure out what's a problem, what's an issue, and what do I really need to focus on? Is that just an inconvenience and it sucks to deal with? Or is that something I really need to buckle down and work on? And I think it's something that takes time to develop. It takes time. I'm not there. I'm just working on it. And it's something that, trying to figure out exactly how to make myself better. How to make myself a better husband, better father, a better physio, a better brother, a better kid, all that kind of stuff. And just trying to make myself as good as I can be, I guess.
Amazing. I just feel motivated to exercise and keep organized now. It's amazing.
Mm-hmm. It does work. It's weird, but it does work.
Yeah, especially now with pandemic, I think it's really important.
It's super important, right?
Yeah. Awesome. Is there anything that you would like to add and say to those who are listening, who are interested in taking this similar path before we wrap things up?
I think just make sure, I think if you take anything, work on your balance, trying to figure out, how to manage all the things you need to manage, making sure you're accomplishing what you need to accomplish at the end of the day, but making sure you take time for yourself and make sure you take time to reconnect and make sure that, you're spending time not just out in school and not just hammering out assignments and things like that, because you need to also be a human, to be a person, and just talk to people, learn their stories. People are amazing. People have amazing stories. Even the person, even the person you might walk by and you don't even know who they are. Just, if you have time, talk with them, see what they're up to, make sure they're good. And that really does help kind of reconnect us as a community, and UW is fantastic for that. And the other programs I pursued were fantastic for that. It creates a community, and that community is super important, especially during something like this, where we're more disconnected from people. We're communicating with this interview over the internet. I would love to be sitting and having a coffee and talking about this and actually seeing you and being in person. That's what it's all about. And that really helps foster that level of community. So hopefully we can just keep pursuing that. And I think everything else will work itself out.
Yeah, I think with technology, it's easy to reach out to peers.
It gets easier and easier, right? Yeah.
Okay, thank you. Thank you again, Mike, for joining us. And
thank you.
For everyone listening, have a wonderful day.
All right, that's the end of the interview. There are more healthcare careers podcasts coming your way, so be sure to check them out. Thank you for listening.